about. And the reason that I invited, pardon me, invited Cassie and was so set on having this topic addressed and recorded so that it can be shared is that I've had a personal experience and need for the agency that Cassie is executive director of. I was widowed in my 20s and had a young child. And if an agency like Pickles existed, the peer-to-peer support, it would have made a world of difference in this person's life. So I've got a very personal commitment to what Pickles is doing, to what Cassie is doing. So without trying to say what they do, I'm going to invite Cassie to be welcomed and present to Rotary members all over whoever can receive this recording about what you're doing.
Yeah, thank you so much, Sharon. And just thank you, all of you, for having us here today. I think Sharon is an incredible example of an advocate and a champion for our work out of a really personal lived experience. So I also just want to recognize that and express my gratitude to you for the support you've given the organization, but also kind of the vulnerability with which you share. I think that's one of the big things about the work we do is creating space to connect about some tough stuff that families go through. And from the first time I met Sharon, I was just really impressed with her openness about her lived experience. So I just want to thank you and thank all of you for having me here today. So I'm gonna open up my slide deck actually and give you the official kind of overview of what we're up to at Pickles Group. And one of the really exciting things I think for presenting to this group and then being able to hopefully share the presentation more broadly, we're founded out of the lived experience of families in your backyard in the northern suburbs of Chicago. And we're doing really great work there, but we're also serving families all over the country. There's just such an unmet need. So let me get my PowerPoint presentation up and running. And I'll tell you a little bit about Pickles Group, and I'll try to be quick so I can leave time for questions. So you can see on the slide here, Pickles Group, we are one of the only nonprofits, a very small set of organizations in the entire country that's focused on providing support for kids who are impacted by a parent's cancer diagnosis. So that's really what we do. And I kind of teased this already. We're about a year and a half old, and we're really born out of the lived experience of these three families that you can see on the screen who are North Chicago suburb residents. So the Smith family on the top, the Agnew family in the middle, and the Lavacek. These three families really came together in 2019, got connected, were referred via friends and peers. They sent their kids to similar schools, but they were connected around this experience. Every single one of the families on the screen was facing at the same time at least one parent's diagnosis of incurable cancer diagnosis with kids at home in middle and elementary school. The Smiths, the Agnews, the Lavaceks got together, they connected, they were talking, how are things going? How is treatment going for you? And one of the big things that came to the forefront the first time they talked about their experience was that all of their kids were having a really hard time navigating this diagnosis. In two cases, it was dad who had been diagnosed with cancer, and then in one case, it was mom. But the kids just really connected around feeling alone, feeling like their friends didn't get what they were going through. Their teachers at school couldn't understand this. And so you see the quote on the screen is actually from one of the eldest Agnew kids, Molly Agnew. She went to her dad and said, I wish I could be around other kids who get what this is like. She just could really self-identify the sense of loneliness. And that's really how our organization was founded and born. So this group of families tried to problem solve. They tried to figure out what they could do to support their kids in a world where they're having trouble finding resources, and essentially ran a pilot program that then has evolved into the seeds for our nonprofit organization. They connected with an incredible clinician, a woman named Kelsey Mora, who's now our Chief Clinical Program Officer. She has a background both as a therapist and a child life specialist, came out of the Advocate Aurora Hospital System in the Chicago area. Kelsey ran a support group for the kids, and it was healing, transformative, and they really said, there's probably other families out there who can use this. How do we get this going? How do we see if other families can benefit? And that's how we got started. And just a quick thing, I will share, Pickles, how did we get to this name? So on the first meeting of the kids in our pilot program, this group of families and their kids, the kids were trying to figure out what else they had in common besides having a parent with cancer, and realized they all loved pickles. So that became their inside joke. They called themselves the Pickles Group. And when the organization was actually founded and they were looking to name the organization, the kids were very clear that it had to be Pickles Group. So that's how we got here. So you can see here on the screen, as I shared, there really is a gap in terms of this service in the broader cancer support system. So I always say one of our founding parents was a professor at Northwestern, one is a professor at University of Chicago. Like, if these folks couldn't find the resource, it isn't out there, and that's really what we've seen. So we are specifically and uniquely focused on supporting the kids of adult patients diagnosed with cancer. And it's really easy for those kids to be forgotten, because a lot of the adult social workers who are working with the patient, their expertise is not kids. Folks who are trained to work with kids are working in the pediatric hospital or unit. So there's really this gap, and that's what we're looking to do. And we are now incorporated as a nonprofit, and we're focused on serving this group of young people. So just a little bit of background, I won't spend too much time here, but sometimes when I'm talking to schools or I'm talking to other nonprofits, I'll get the question like, how many parents have cancer? Is that really a common thing? And it is. And this year we actually got some really important data that there is a dramatic rise. As you can see here, this is a report out of Harvard in cancer in folks under the age of 50. So they just had this first longitudinal study come out that had kind of information comparing the last birth rate cohort. And a lot of this is being attributed to environmental factors, lifestyle factors, things that we don't understand yet. But whether it's breast cancer, colon cancer, we're seeing actually younger and younger folks diagnosed with cancer. And that really means we've got more people who have kids at home who are going through one of the hardest things maybe they've needed to navigate, and kids are impacted too. So you can just see some of the context there. So I teased this a little bit. We're really anchored in behavioral science and the research and best practices around supporting the social emotional well-being of kids. A lot of times, my background is in education and youth services. And a lot of times in the education system, when we're talking about young people, we might talk about adverse childhood experiences. So for example, my parents got divorced and my dad had a gambling addiction. Those are two adverse childhood experiences. And there's a lot of research about that, having tough stuff happen when you're young, and what are the implications of that? And it doesn't mean that there's necessarily going to be hardship for a child, but it does mean that there's an increased chance that kids can be anxious, depressed, absent from school. This can impact the long-term quality of life. So whether it's divorce or whether it's having a really sick parent with cancer, we know that this is the kind of time in a young person's life where you want to provide more support. You want to kind of intervene, wrap your arms around them. And that's why we're here, just to name this lived experience and support kids. So how do we do that at Pickles Group? I mentioned everything we do is anchored in behavioral science and best practices. And a lot of that comes from our Chief Clinical Program Officer, Kelsey Mora, and her training. So there are 3 things that are proven to help kids when their parent is diagnosed with cancer, really research-based. The first is helping families have open conversations about what's going on. Diagnosis, treatment, that's really hard. We hear from the social workers in the hospitals, the most frequent question they get from parents when they're diagnosed with cancer is, first, am I going to be okay, right? But second, it's usually, what am I going to tell my kids? Like, that's just this overwhelming kind of, how do we talk about this big thing? So we really are there to help families figure that out and figure it out in a way that works for them. But kids are really curious. They're creative. They'll try to figure out the why if they don't have information. So that's a big part of the support we provide families. The second thing is helping kids develop coping skills. So these are skills that are going to be helpful through any hard thing in life, whether it's a hard math test or a breakup with a boyfriend in high school or whatever it is. But helping kids figure out how to identify their feelings and healthy ways they can work through those feelings. This is a great time to do that. And then the last piece is peer connection. And you saw on that first slide, Molly Agnew said, I wish I could be around other kids who get what I'm going through. There's actually research. It's any support group. It's kind of, human connection 101. Being around other kids who get that experience of having a parent with cancer is really healing for the kids. Oftentimes, they might not have met another child whose parent has cancer, and that can feel really lonely. So these three things combined are really what we lean into for the programs and services we provide. So what are we up to? How do we translate all of that into actual care and support for kids? There are three things that we're really focused on right now. So we do monthly How to Talk to Kids About Cancer webinars. We also partner with schools, hospitals, nonprofits that might be connected with patients, with families to train them so they can better support families in this way. But that's a free resource. So we'll get parents, grandparents, aunties, uncles, teachers, nurses who hop on that webinar to learn more. But families will be there for sure. Mom was diagnosed with breast cancer a month ago. This might be the first place she comes to figure out, like, am I going to tell my kids? What am I even going to say? The second thing we do on a monthly basis that is in your backyard at Winnetka Community House, we have a monthly in-person program that is really serving kids effectively. So we train highly skilled facilitators to go through play, art-based activities that connect the kids and really go back to everything we just talked about, that coping skills, learning and talking about cancer, but also connecting with peers. That program has been really successful, and we're getting tons of referrals from North Shore, Northwestern, kind of our local hospital system. What we learned really quickly, though, as we got started, and we really started providing services when a vaccine was just becoming available for COVID, a lot of our parents are immunocompromised, and they're really trying to take care of themselves as they're going through chemotherapy, all of that. They're also tired. They're going through one of the hardest challenges of their lives. And having the flexibility of a virtual program for kids has been a game changer. So we have a really high quality virtual program that we designed, not just on our own, but with a woman who's been teaching for a decade at an online charter school, where we're able to serve kids all over the Chicagoland area. We're able to serve kids in the North Shore whose parents, don't feel like driving on that Sunday because they're having a hard time just getting through life right now. And we serve kids actually all over the country through our virtual program. So that's been a huge game changer from an access perspective. And we do that on a quarterly basis. So we actually just launched our summer program last weekend, and that's something that families can sign up for as well. And then the last thing, we're really developing content expertise that we can share with schools, with hospitals, and with families to make sure that there's more out there for kids. So we have a family cancer support kit we share for free with schools and hospitals. That's an 8-page booklet that really talks parents through, navigating this experience with their kids. We will get on the phone and help families navigate resources. So all sorts of things that we're doing right now to make sure that our kids have that support as their parents are going through this really tough experience. So I'm going to jump through the next slides. I'll send you the deck, but everything we do, again, we're thinking about the outcomes. We get incredible feedback from our families, and we're really looking at hopefully seeing impact over time. We're serving families like the Lagos family you see here in the Chicagoland area. Mom was diagnosed with non-small cell lung cancer in January of 2021. they are some of our families that are showing up every single month. So just an example of the type of impact that we're making. And then in terms of our team continues to grow, but on top of our existing staff and board members, volunteers are really critical to our work. So we're really drawing on youth experience, mental health experience, cancer support experience to try to create a unique nonprofit to meet this need. So how can folks get involved? I'll kind of leave with this and then answer questions. So if this cause speaks to you, maybe you have a personal experience like you heard from Sharon, maybe you just want to give back, there are a few different ways you can do this. First and foremost, we are always looking to connect with families and make sure they know that we exist. And so if you know anybody who can benefit from our services, please send them our way. We've got an online referral form. You can reach out to us directly. We also are always recruiting, and right now especially, we train volunteers to facilitate our groups, both online and in person. Our volunteers need to have at least a year of experience working with kids. So that could be a teacher, that could be a social worker, you could be retired, you could go through school right now, but we're always looking for volunteers to give back in that way. And then it's really about awareness. So like I said, you heard me mention schools, hospitals. We're looking to make sure other partners who can refer families to us know about our organization. Rotary is a great example. So if there's anybody who should know about us, please connect us. And like many other nonprofits, we really are grateful for and able to do this work because of support. And that includes financial support from individuals and companies and all that good stuff. So making a one-time donation, a monthly donation makes a huge difference and allows us to serve more kids. So that's it. I will pause and then see if there are any quick questions, but just really grateful we're in your backyard. We're able to grow and do this work because of supporters like you. So thank you for having us today and helping us spread the word.
Thank you, Cassie.
Thank you,
I'll open this up for questions.
I don't have a question, but I have a comment that I think Cassie might not know of. The Molly Agnew that Cassie mentioned, the child of Mark Agnew, who was one of the founding families, was someone whose grandmother I met the first time when I was exploring becoming a member of Rotary. Bonnie Agnew, I don't know if any of you knew Bonnie. Bonnie Agnew was a member of the Wilmette Harbor Club, and I attended as a guest, and I was just thinking about when that was, and I believe it was around the mid 80s. And I was